All right, good morning, everyone. Thank you for joining us today. Very excited to have you participate with us. First, before we get started, I just want to do some territorial acknowledgements. And I want to acknowledge all the areas where our presenters are speaking from today. Myself, I'm in Calgary. Crystal, you're in Ottawa. I should have put Ottawa up here. I don't have Ottawa, but I have Toronto. So we are on the unceded territories in Calgary of the Blackfoot Confederacy, Tsuut'ina, Stoney Nakoda, Métis Nation Region 3, and all people who make their homes in the Treaty 7 region of Southern Alberta. We also want to acknowledge that we're on the unceded territories in Toronto of the Mississaugas of the Credit, Anishinaabe, Chippewa, Haudenosaunee, and the Wendat Peoples and Nations. And further to that, we want to recognize the enduring presence of all First Nations, Métis, and Inuit peoples. So before we get started, just a little bit about how you can interact with us today. The chat has been turned off. You can only send a message to the host, which is me, if you're having technical difficulties. Otherwise, there's two ways that you can interact with us. If you'd like to ask a question, there's a question and answer box right on the bottom. You can type your question there. And then when we get into the question and answer period, I'll read those questions out and give either myself or Crystal an opportunity to answer them. And if you'd like to ask your question verbally, what you could do is you can raise your hand during the Q&A period. And what I'll do is open up your microphone when it's your turn to speak. What I've noticed on Zoom is there's a few different places, depending on the Zoom version that you have, to raise your hand. The first one is if you click on the participants box, you might see the raise hand right there on the bottom. Second time, sometimes it's not there and you need to click the more, those three dots, and then you'll have the raised hand option. And in some cases, I've even seen it here on the reactions button, where if you click on that, you get the raised hand option. So those are the three ways that I've seen it. In any case, as I said, once we get to the Q&A, you can either type your question or raise your hand in order to interact with us. Once again, thank you for joining our workshop today. Jumpstart Refugee Talent, as many of you know, is a refugee-led organization where we focus on the economic empowerment of newly settled refugees in Canada, supporting both meaningful employment and entrepreneurial opportunities. You can always visit our website to learn more about how we can provide support. And a big way that we do provide support is really trying to facilitate or accelerate your employment readiness. You know, what we find is that for somebody who's lived in Canada most of their lives, usually takes around, under 6 months to secure employment. But for refugees, it could take a year or more. So what we want to do is provide you with those supports to shorten that amount of time and get you to where you want to go much quicker. We do that in a variety of ways, whether it's helping you with your resume, creating an employer-friendly resume for you. Of course, many of you today are participating in our mentorship program, and if you're not, you should. Welcome Talent Canada. It's an amazing program where we pair you up with somebody from your industry who just acts as a career coach. Helps you develop your professional profile, navigate your career path, expand your professional network. We have our West Gateway. It'll be very important for many of you in healthcare to get your education recognized here in Canada. And of course, we offer a variety of different workshops, as we're doing today, to help you improve your skills. You can always check out our website. We put all of the past recordings for some of our workshops up on our site. Something new that we're going to be introducing in the next few weeks, and we're very excited, is this idea of career pathing, somewhat like what we're doing today. And it's really meant to help you navigate the system. Often if you come in and you want to enter an industry, whether it's a new industry for you or trying to continue where you left off, there's so much information, so much resources, and you don't know necessarily where to start. So what we've started doing is compiling many of these resources, and you'd receive a report from us. So everyone here will receive a report sometime in the next couple of weeks or so that shows you places that are either offering, bridging programs, certification programs, training programs, resources, just to make that process of finding those resources much easier for you, rather than you having to look through the internet and spend hours and hours and ask all kinds of people. Jumpstart will do that work for you and provide you a report. So this is just kind of a sneak peek of some of the resources that we've already, taken a look at. So for example, healthcare, we have, programs for midwives, dentists, doctors, nurses, and a variety of different programs as well. So, stay tuned. All of you will receive this report, depending on the industry that you've indicated to Jumpstart, sometime in the next, few weeks. But first place that we wanted to start, this is our first event for Careerpathing, was looking at a segment in the healthcare industry. We know healthcare is very big, but one small segment, which is home and healthcare. And we're very proud to bring one of our partners in here today to talk to you about this career path, which is SC Health. They're a nonprofit partner, deliver a variety of programs to get you trained, but also employment supports to be able to get you on the job and get you working. Before I introduce our speaker, I'm just going to take a moment to show you a little bit about what the two main opportunities that we're going to be talking about today, which is home care support worker and personal care support worker.
Home support workers and personal support workers play very important roles in our healthcare system. We value their tremendous contributions and rely on their incredible commitment to care every day. What makes their roles so important? HSWs and PSWs assist people with basic functions of daily living. This includes feeding, dressing and undressing, lifting and transferring, bathing, personal hygiene, and safe bathroom use. Many personal care workers may assist with medication and medication reminders too. They also perform light housekeeping tasks, from sweeping and mopping floors and vacuuming to washing dishes, laundry, and simple meal preparation. Even though the roles are similar, HSWs are trained to care for less complex clients in their homes. They assist and provide care to individuals who are more independent. PSWs are trained to care for less stable clients and those clients with higher levels of dependence. Home support workers and personal support workers are part of a team that delivers holistic care to people who need it in the places they call home. We are proud to recognize the hard work of HSWs and PSWs for their care, kindness, and compassion, and for making a big difference every day.
All right, so without further ado, I'd like to present our session lead today, Crystal Washer. She's a talent acquisition manager. So she's always looking at talent every day at SC Health, and she'll talk to us a bit more about this career path and opportunity. It'll be a short presentation. Really, we wanted to focus most of the time here about being able to answer your questions. And as we talked or as we mentioned to you, either when you signed up or when you got an email, we'll be contacting everybody who's attended this event afterwards within the next day or two to find out if you're interested in the program. And if you are, we will work with you to try to get you an invitation to our next event with SC and Health, where you'll actually be able to meet with their program staff or talent staff, and they can talk to you and see about your eligibility to enter their amazing programs and supports that they offer. As I said, we have a lot of time today to spend with Crystal, answer your questions, and beyond that, you will get a call from Jumpstart within the next 2 or 3 days to talk to you more, to see if you have any questions and find out if you're interested in moving forward and exploring these opportunities with SC Health. So I'll stop sharing my screen now. pass it over to you, Crystal, and take it away. Thank you so much for joining us this morning.
Absolutely. And thank you, Malaz, so much for the wonderful introduction. I am very honored and grateful to be joining you guys here today and talk to you about some of the career opportunities that exist within our organization. As Malaz said, my name is Crystal Washer, and I am a talent acquisition manager. My focus is campus and pipeline development. So I target people who might not have healthcare background or experience and try and engage them into a almost pandemic-proof opportunity for the future. Healthcare is expanding and growing, and the entire world is looking for more people to work either as personal support workers, nurses, doctors, and those in the healthcare field. Within our organization, we are a nonprofit. The joys of working from home, you can hear my dog in the background. We have been around since 1908, so we do have 115 years of service excellence as an organization and lots of opportunities both in healthcare and supporting healthcare technology, information, human resources, and other. So I'm going to share my screen and show you a small presentation about our organization, kind of where we are, where we came from. So I'm just going to share the whole thing here. There we go. And play. As it's loading up, there we go. So SE Health, we are empowered, right? We're powered by the people who are dedicated to changing lives and making healthcare better. A little bit about us, as I mentioned, we've been around since 1908. We are a trusted name in Canadian, obviously in the Canadian healthcare world. Our organization focuses primarily on home healthcare. We truly believe in that holistic environment. Having your family members at home and allowing them to age and grow and stay with you and be able to move forward in their day-to-day activities with dignity is the main focus of our organization. Statistically, as we know, those who are able to stay at home have a much better success rate and a much better quality of life because they're surrounded by their loved ones. And if you've ever cared for a family member who's had an illness before, whether physical, maybe they've undergone a surgery and you've had to help them recover from that, or they needed some extra support with feeding themselves or bathing themselves. This would be a wonderful opportunity to give back to other family members who are going through the exact same challenges. So since the beginning, we've always focused on healthcare. We actually started with nurses, 4 nurses in particular in Toronto, and they would help pediatric patients, as you can see from the lovely baby getting a bath there in the bottom.
Sorry, Crystal, it looks like your screen is frozen, so you're still on slide 1 is what we're looking at.
Oh, so I moved slide 1. Has it moved forward here?
No.
Oh, no. How about now?
Yes.
So apologies, as I'm referencing a baby taking a bath, it would make sense if you could see the wonderful child there in the bottom. We are nonprofit, which does mean that everything that we do is to give back to the communities that we are a part of. It also means that we have a lot of community partnerships and available supports to help you grow within our organization and for the future. When we talk a little later about benefits, it means that we have a lot of support from restaurants and gyms and activities, phone plans, homes, mortgages, car rentals, and there's so much that we can help you with to further your career and be there for your family to have a good work-life balance. So the main opportunity I wanted to talk to you about here is our free PSW training. So our organization sort of capitalized on the mantra, earn while you learn. In Ontario, as we saw from the video, there are 2 different types of home healthcare workers. There's home support workers and there's personal support workers. So what we do is we bridge those together into a 6-month training program. The first month of the program is paid. You are paid to take this. It is a paid training opportunity, and it is live instruction. So don't worry, you're not signing into a classroom and watching a pre-recorded video of an instructor going through a lot of heavy technical information. You are actually provided with a cell phone, so you can contact us and other students in the class at any time. You're provided with a tablet, so we give you the technology that you'll need to be successful in this program. We also give you all of the textbooks, course materials, and writing utensils that you'll need to make notes, make adjustments, and they are yours to keep. On the tablet, you get to sign in for your classes from 9 till 3, Monday till Friday. You are paid to do so, and you are joined by anywhere from 10 to 12 or perhaps more with a second instructor, where you can join in and find that camaraderie with your peers, learn about being a home support worker. As you saw in the video, it's daily living activities, right? People who still have mental cognizance. They're still able to feed themselves and bathe and change themselves, but they need help with some of the other things in their lives. So that's what we do to support. There's also a lot of clinical training, and we make sure that you feel comfortable with first aid and CPR and being in someone's home. Then at the end of that 3 weeks of virtual training, we provide you on-the-job working experience, where for a full week, you actually shadow or preceptor another well-trained home support worker who will teach you the ropes in a long-term care facility and in a home care environment. Then you write a small exam, and if you're successful, which most people are, then you receive a certificate which recognizes you as a licensed home support worker with our organization. So while you're doing the training, you're receiving at least $15 an hour for the training itself. At the end, once you graduate, it increases to a minimum of $16.50, and you also receive a $3 wage enhancement. We call it a government premium that is being offered by the Government of Canada at this time. And so you're making $19.50, and you are encouraged to start working right away. We know that a lot of people want to go beyond home support and bridge to the next level. So the next 5 months beyond that, the next 6 months beyond that is the personal support worker certificate. Now, in most industries, this certificate costs anywhere from $4,000 to $6,000 through a college. We will give you that certificate for free. However, we don't pay you to take the course while you are taking it. It is free education at this time. However, you are licensed as a home support worker and are encouraged to work while earning, so you're never short of a paycheck while you're taking this free upgrade program. The class times are condensed, they're shorter so that you're able to work around the class times and fit that into your schedule. So as I said earlier, the first month is 9 till 3. The next 6 months are from 11 till 4. So if you are an early riser and you wanted to work before class started, you will have some clients that you can go and see while you're earning a paycheck. If you wanted to work after class or on weekends, we only ask for about a 15-hour commitment so that you at least have that paycheck. If you want more hours, we definitely have those available to you. And if you want less, as long as it's an average of 15 hours or you're committed to sort of working more one week and less another during scheduled time off or holidays, then you're welcome to do so. We also built in some bonuses. We know that it is a big commitment to go to school for the next 7 months. So as long as you come into day 1, we will provide you with a nice $100 bonus just to say thank you. You've picked up your technology, you've listened to our spiel. We hope you enjoy the process. Here's sort of our bonus for attending. Then after completing the HSW program, we provide you with your certificate and an additional $500 as a way of saying congratulations. And you can use that towards anything that you would like. After you complete the PSW program, this is a certificate that is recognized across Ontario and across Canada. So that personal support worker certificate, you hopefully want to work for us afterwards, and you are guaranteed full-time or part-time, if that's what you're looking for, job opportunity immediately upon graduation. PSWs can start anywhere from $18 to $19 an hour, plus that $3 premium. So anywhere from 21 to 22 plus that you're receiving once you graduate. Now, if St. Elizabeth wasn't the organization for you, we recognize that we've just provided you a free certificate. So as long as you're okay with paying back the certificate, you can take that to any other industry, hospitals, long-term care, retirement residents. But we'd like you to work with us and continue to serve the community. That way you don't have to pay anything back whatsoever. On that note, once you do graduate, we give you an extra $1,000 bonus. And if you happen to be with us 18 months later, we'll pay another $1,000 as a way of saying thank you. And hopefully you've been enjoying the process so far. That was a lot of information. So we know towards the end of the presentation, there will be some questions and I'll be more than happy to field those. And as Mala said, you will get a copy of this, so you can always reference it later in the future. Once you do graduate, we do offer benefits. Now, I was going to show the video, but you have already seen it, so I'll move past. Oh, there we go. Some of the benefits for working for our organization, just going to move past that. There we go. Some of the benefits is you do get that hands-on training. So the first month, as I mentioned, is 3 weeks virtual, 1 week in person. The PSW portion is 6 months and a combination of clinical, so you're doing that online virtually with an instructor who is live, and then you'll do some in-person training. The final stage is you complete 2 practicums. You'll do 5 days in a long-term care facility under the supervision of a nurse and our PSWs. And then you will do a local community preceptorship where you'll go out into the field with a PSW and a nurse, and they will walk you through what your job will look like when you graduate, and making sure you feel comfortable with all of the skills, all of the technology, and all the resources you need to be successful. If you're not so much interested in the PSW or HSW side and you would like to go into a bit more of the administrative side, there are other opportunities that exist within our organization. Of course, we have service coordinators because someone needs to be able to schedule and plan the healthcare team's days. So if you have some experience with administration and you might be interested in some service coordinator roles, these do not require a specific certificate, and we do provide on-the-job paid training. So if you are interested in the program, which I hope you are, fantastic. And if you would like to go into a bit more administration, there are other options with our organization. We also have records management clerks because, of course, you're dealing with medical documentation. For this one, we do prefer certificates. However, we do provide on-the-job training so that you can help identify and organize any of the medical records that we receive through our organization. And most of our office positions start at a minimum of $34,000 annually. For all of our positions, benefits do include medical, dental, and optical insurance. Whether you're full-time or part-time, those do kick in after 90 days of employment. So you actually start receiving benefits while you're in the PSW program, and that is for you and your family. We offer 3 different types of benefits, whether it's basic, slightly more comprehensive, or very complex, depending on what you and your family might need. Some might include premiums, so perhaps orthodontic care or osteoporosis or massage therapy care. But for all of these, we do give you a package. You can go through the different benefits. We also offer a pension to all of our employees. It is company matching. It is with Sun Life Financial. And after 1 year of employment, you are automatically vested into this program. You can make contributions from your pay stub, and St. Elizabeth will match whatever you put in, and that money is yours. We also have a lot of discounts through our Work Perks program, things like restaurant packages, gym memberships when we can enjoy those again, insurances, mortgages, banking, and so much more. Things like meal planning, good food. We offer some discounts and bursaries for like new cell phones or for phone plans, home internet packages. There's so much that is available. We also try and provide as much opportunity as possible to grow in your own professional development. So Malaz had shown you a very wonderful document that tells you different types of bridging opportunities. We are in the process of having our PSW certificate program recognized by some colleges and universities as an entry into an RPN program. So we are working towards a bridge to help you upskill beyond PSW into the nursing world. And a lot of our nurses who are employed are taking advantage right now of the bridge from RPN to RN. So going from a practical nurse to a registered nurse and being able to do so while working and still earning a paycheck. We also provided a minimum 2 or 3 weeks paid vacation, depending on your position, as well as personal days, sick days, and flexible working solutions. One of the best things about home care is it's based on your schedule and the client's schedule. So you can really organize it if you have an appointment that you need to go to, or your kids have an activity after school that you'd like to participate in. As long as you're working your hours, you can manage and self-schedule around those times, which you might not be able to do in a hospital or long-term care facility. So it provides a lot more flexibility and control over your schedule. And as we invest in our talent, we offer a variety of different scholarships. So once employed with St. Elizabeth, we offer bursaries and tuition assistance for you to continue to grow in any capacity, whether that's moving up in the healthcare world, or if you're a service coordinator who'd like to take some human resources classes, we offer a lot of opportunities for that. We have some co-op students right now from Seneca, from Centennial, from George Brown, and from Algonquin College who are working with me, who are all taking scholarships through St. Elizabeth. We also offer paid time off or perhaps even enrollment costs for conferences and general meetings. When you're in a nursing position or a specialty, there's quite a number of conferences that happen on an annual basis, sometimes even biannual or monthly basis, and we do pay for those. We also are very proud to say we spend probably the most out of any of the healthcare fields in clinical practice and support. So that tablet and that cell phone that you receive, you are connected to a 24/7 clinical resource team. It might be scary to think you're going out into someone's home and helping them with, say, a bathing activity. If something happens, what do you do? We've provided hopefully a lot of training to set you up for success in those instances, but on your tablet, you just press a button and you're connected to a live nurse who will help and walk you through any issues that you might be having, as well as emergency supports if you need to call the police, ambulance, or fire department. We also have a staff association, which is also known as a social committee, to help keep you engaged with things that are happening within the organization, any new skills that might be available, any new training, any conferences, events, or even just keeping in contact with your peers if you have questions about clients or how to handle certain situations. And if you're interested in some leadership development, we have an in-house program called Leadership Edge, where we help you grow and develop your own leadership skills and capacities under the mentorship of some of our senior leadership team. And of course, as an organization, we like to have fun because we're a community provider and we're nonprofit. A lot of what we do is within our local communities. As an example, I live here in Ottawa, so we're huge with the Children's Hospital of Eastern Ontario, the Ottawa Hospital, and the Beth Donovan Hospice Care Society. So pre-pandemic, we do walks, we do bake sales, we do a lot of team bonding activities and events where we raise money, and then we give back to the communities that we're a part of. So definitely want to continue the conversation, and thank you so much for joining. I will stop sharing this screen, but before I hand it back over to Malaz into the Q&A, I just wanted to show you an example of what the course would look like for you, just to give you an idea. Can you see my screen still?
Yeah.
Perfect. So it is built in and you do receive a copy. We have a class that will be starting in February in Toronto. We are actively recruiting for this one right now. Just to give you an example, it shows you that we do theory, right, Monday to Friday from 9 till 3 via Microsoft Teams. We also do the skills, so it'll show you which days you're going to be involved in which part of the training program. It'll also show you which days are your preceptor days and practicum. And while you're doing so, this is the training opportunity that leads to employment, meaning you're in constant communication with the person who will be your supervisor once you graduate, and they will be able to build a schedule and a caseload for you while you're in school. So you transition directly from education and training right into on-the-job support, and then your own personal client and care load after that. We also go through all of the PSW days, PA days. You also have opportunities for time off, any of the statutory holidays, of course. And depending on when you're joining the organization, the college actually closes down for a period in March for March break, as well as in December for Christmas break for the students. We're also very accommodating. If something happens out of your control, we will absolutely make up days so that you're able to still be successful in the program. You do have to commit to the program, though. You can't miss more than 2 weeks worth of classroom time. However, we understand in the world that we're in right now, we need to be a little bit more flexible. So we will understand if something comes up. And on that note, I'm sure you have lots of questions for me today. So I will hand it back over to Malaz.
Thank you so much, Crystal, and amazing to see the opportunities that you talked about.